Hello friends, welcome to Creative Medicine. In this lecture, we will learn about.
Hello friends, let us now learn some important points about the insulins. So if you see insulin aspart here proline at B8 of human insulin, B8 of human insulin is replaced with aspartic acid for insulin aspart. That is the reason why we call it as aspart, insulin aspart. Then if you see, we have insulin glulicin. What is glulicin? Here it is an insulin analog with lysine replacing asparagine at B23 and glutamic acid replacing lysine at B29. Then if you see insulin glargine, in insulin glargine it is long acting biosynthetic insulin with additional arginine residues, with additional arginine residues at carboxy terminus of B chain, and here glycine will replace arginine. Glycine replaces arginine at A21. Okay, then we have the next insulin, which is insulin detemer. Insulin detemer, which is myristoyl fatty acid. Insulin detemer, here myristoyl, which is a fatty acid radical. This myristoyl radical is attached to amino group at B29 of insulin chain. Okay, whereas in insulin lispro it is produced by reversing proline and lysine at carboxy terminus B28 and B29 positions. So this is about insulin. Thank you for watching.
Thank you and thank you for watching.